I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Welcome, Sarah, to the show. Could you tell us a little bit about yourself, your background, and what led you to writing Taking Care, the story of nursing and its power to change our world?
Yes, thank you so much for having me, Amie. I'm so pleased to be here with you. I'm such a big fan of your work. And yes, you know, a little bit about how I came to this moment in my life in this conversation. I went to journalism school. I have a master's in journalism. And for a very long time, I actually was a magazine editor. I was a staff writer at the Village Voice, but I focused actually on food, food politics, food policy, restaurants to some extent. And so I did that for many years until my daughter was born. I went freelance and I started writing about healthcare. So that was about 11 years ago. And I found that one of the things I love about journalism is that the skills that you have can translate sort of between beats. It's really, my feeling is that your most important skill as a journalist is not being afraid to ask stupid questions or just not be afraid to have a conversation and ask people what they think. And so I started writing about healthcare. I wrote a book about premature birth. And since then, I've been really using what I think I know as a family member of people who have been quite ill and moving through the healthcare system in the United States, as well as my journalism skills, to really try to bring forward what it's like for patients and providers inside healthcare systems. And so what brought me to Taking Care was actually this sort of lived experience that I knew that nurses were doing the the vast majority of patient care, direct patient care, um, a lot of the care that matters most to families. And I didn't see that represented in stories out in the world for a general audience. I know there's a lot of really rich conversations happening within the nursing world. And I wanted to do my small part to kind of step into that and say, there's a lot of stories here that are really important.
Yeah, I think you did a really good job. I mean, I've read your book now more than once, and I think that it's such a powerful read. And I think it's a powerful read for not just for nurses, but for kind of anybody who really wants to have that kind of lens peeled back and understanding kind of the work that we did. Was there any story that kind of led you to being like, this is what I need to write about today? Or, well, over the course of the time that you wrote the book?
Right. There are so many different ways to answer that question because the literal answer is that my editor of the book about prematurity asked me, "What do you want to write about next?" And I had some sort of half baked ideas. And she was like, "I don't think that's quite it." And then one night I actually had a dream and I thought, has anyone written a cultural history of nursing? And I just kind of like popped up out of bed. And people have as scholars, but no one had written one for a general audience. That honestly blew my mind because why not, right? It's one of the oldest, most culturally, scientifically rich professions. And so that was literally what happened. And then I went and told my editor, and she said, that is a great idea. And so that sort of sent me off. But I think that the reason that that was in my head to begin with was probably experiences that I had with nurses as a child and also as a mother myself. And both of my parents were very chronically ill when I was growing up. And then they both died relatively young of those diseases. And then my daughter was actually born at 28 weeks. Thankfully, she's doing wonderfully. She's now in 6th grade. So, but again, I found myself in an intensive care setting for many months and had so many powerful experiences with nurses in the NICU. And so I think that it was a combination of my desire to tell stories that haven't been told as a journalist, but also those personal experiences.
Yeah, no, I think that is amazing. And I think it's important that when we do tell stories, it is shaping our own worldview of the people that we're interacting with. I think that's what makes storytelling so powerful. And I think it's important that, we get that other perspective from, not even just a nurse, but from someone who has interacted as a patient, as a family member, seeing your own family members interact through the care system. And I almost wonder for you as you were writing, is it if it helped you kind of navigate healthcare a little bit more as well. And I think that, I think about the history and all the backstories and things that you wrote. And I kind of think to myself, I'm like, so this should be topical. Like we should have this in our nursing, like our education, because there was lots of things that I was like, aha, how come we weren't taught this? How come we didn't have these conversations? And I think one of the biggest ones to me was really this idea behind nurses really holding on to Nightingale. Like she is, whenever people think of nursing, and that's even how I started my book, like tell me a famous nurse. Who's the first person that comes to top of mind? It's Nightingale. And I think nurses really struggle with the concept of what does modernization of nursing really look like? And then understanding who she was as a figure to nursing now, right? Because I think a lot of people will, she was a product of her time, da 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 da. But understanding, like, well, what does that actually mean for nursing as a profession and how we, hold her up in this particular way? With your viewpoint, this archetype, has actually harmed nursing. What are your thoughts on all of that? I mean, I know there's thoughts that you have in the book, but what are your thoughts like
Yeah.
immediately?
Yeah. Well, I agree with you, first of all. And as a non nurse, when I started researching nursing, even though I had been covering healthcare for a good number of years at that point, the first person who came to my mind was also Florence Nightingale. And I sort of thought
Right.
to myself, I honestly wasn't really looking forward to that part for some reason. I didn't really know yet why, but I was like, oh, I guess I have to read a lot about Florence Nightingale. And so I did. I thought, oh, I see. Like, this is one of those lone hero myths. And this has created this kind of like archetype that is actually quite false. And so, where I came down on it was that, I find it a little bit. I'm not a fan of Florence Nightingale. I also find like a conversation about her as a person is a little bit limiting because it's like, yeah, she was racist and other people in her time weren't. Right?
Right.
She was very
Thank you for
tied.
saying that.
Right. So it's, there were other people who understood those things or who, who were thinking about those things in a different way. She was thinking about it in this way. It's a viewpoint that I find abhorrent. And, like, she's gone, So what's important about this now? I think what's important about this now is that she is the person that people think of. She has become sort of this archetype of who is a nurse. So what does a nurse look like? And what kind of a family does a nurse come from? What kind of work does a nurse do? There were things about her that I find, worth considering, like, her use of statistics to describe the effectiveness of sanitation, or, the fact that she did think of nursing as separate from physicians' practices and that she wanted nurses to have their own kind of chain of command. Now, that chain of command can be pretty harmful in
Right.
nursing, right?
Pretty
There's
militaristic
that
almost.
militaristic. There's this hierarchy. Nevertheless, the idea of having a female-centered profession, and here I always want to say, nurses were never only women,
Right.
aren't now, and they never were. But, she carved this out for certain women. Okay. And she did a lot of harm also. And so the reason that I think that that's important now is that, as I said, when you think about who is a nurse, what does a nurse look like, what does a nurse do, you're thinking about this very regimented, sort of very tied to class, very tied to race and to whiteness. And that is the image in many people's mind of a nurse.
Right.
And again, it's not true. It never has been. I did read one scholar who said one of the most important in sort of a neutral way, right? Like one of the most lasting impacts that Nightingale had was not just on race and class, although those were very important, but also the idea that nursing isn't for men.
Right.
That was very much part of her worldview. So I think it's important that we understand that so we can tear that down and build an understanding of nursing and stories of nursing that just go beyond that. And it doesn't mean that no one should ever talk about Florence Nightingale. It means that we should also talk about all the other many nurses from all over the world, from every
Right.
tradition that were nursing. And the idea that she invented nursing is absolutely absurd. She went to nursing school.
Right. Which is like,
I mean, nursing is ancient. It goes back to prehistory. So, no, she didn't invent nursing. And it's interesting to think about why people want to think that she did.
well, I mean, it's no question or surprise, even just kind of, I know we're not going to talk about current events right now, but even just thinking about some of the politics and some of the worldviews that we're seeing kind of creeping in right now, right? The whole idea behind like the book, The Handmaid's Tale, and all these different things. Like, it's not a surprise to me to see how deeply rooted nursing is in white supremacy. And I know some people will get mad at me, but it's fine. It's the truth. Where people can't, like, it's that weird, like, little hero complex, right? Where in this individual, where there might be, some good qualities, they cannot see past the fact that this person is still a flawed human being. And that's where I think it's dangerous as nurses, that if we can't, see somebody and be able to understand that, this person is much more complex than, than just the little histories that we're told, that we put ourselves and we set ourselves up in a very dangerous position, a very powerless position, a very voiceless position, particularly based on, the histories that she kind of embodied. And again, speaking to the fact that she went to nursing school, like she's not the mother of nurses, and knowing that there were whole societies of nurses that were men, like it's just like, okay, there's so much more to it. And I feel like,
So much.
nursing has been Americanized. There's like again, like I'm not Florence Nightingale. She was like, it begs to question, and I know the answer as to why she was the figure that was picked, because again, there was many others that could have been picked, but she was the chosen hero. And I think this is the time where we should continue to tell other stories, because history is not just one side of the catalog. And I think that when we miss out on so much when we only tell one side of the story, when we only share one history as a truth, when we know it's not the truth at all.
Yes. And I think it's interesting to wonder, why do people need her to be perfect? Why can't she just be a person who had a lot of, pretty terrible ideas, but also did some important things? The end, kind of. People really, really find it very emotionally upsetting when you let those other possibilities in. And the other thing is, she was chosen from the beginning as somebody who was going to be able to be held up in that way. So the British government chose her because she was well-to-do, right? Because
Yep, she wasn't poor. Yep.
she was somebody who they thought would be palatable,
Right.
because she was so entrenched in the colonial power structure, in the Victorian colonial power structure. She was very, very, she was quite well off. She was unmarried, which was unusual, but also meant that, it was less controversial to have her go away to nurse. So, for all of those reasons, she was chosen because of that. And then subsequently, she was, in fact, made into this icon exactly the way, really, it was planned.
Right. Yeah, I mean, it has a way of doing that, right? I think it's just, even when we look at the history of America, right? I think that there are certain people that are selected to be, that those are the selected stories that are told. And then when we say, okay, let's talk about slavery. It's like, oh, I don't want to offend anybody. I don't want to make someone feel hurt, and it's just like, no, let's stop. We are truth telling. We are saying what happened, and it shouldn't make anybody feel any particular ways. It's what happened. It's like the facts. Anyways,
Yeah.
I can go
And
on
why
about
people
all
feel
that.
uncomfortable is like a whole other story.
Yeah. I mean, so we're talking about heroes, and I think your book highlights nurses who have been largely written out of history due to racism and patriarchy. So, is there any forgotten nurse story that you think modern nurses should know about, that should be that blueprint for advocacy?
Oh gosh, there are so
I know.
many.
I'm sorry. It's like a little bit of a loaded
No, I mean,
question.
there are just so many. I mean, there are really, one of the big lessons of the book, writing the book for me, was I could have written like 5 volumes. I mean, there are so many of these stories. And as a layperson, like as a non-nurse, I didn't know about any of them. And I have heard from nurses that they often haven't been taught about any of them. And I think it's just such a missed opportunity, because these people are amazing. To pick one, Mabel Stopers. Mabel Stopers was was the head of the professional organization for Black graduate nurses in the United States in the years leading up to and during World War II. And the reason that they had that African American or Black nurses had their own professional organization was because they were not allowed in the ANA for the most part. So Black nurses organized in this other way, and Mabel Stopers was their leader at the time. And she was very determined that Black nurses be able to serve in the Army Nurse Corps during World War II, because she knew previously they were either banned entirely or there were quotas, very tiny quotas. It was something like, I'm going to blank on the number, but it was like 36 Black nurses were able to serve in World War
To
One.
World War One.
One, yeah. And she knew that that was not just nurses missing out on being able to get this experience. She knew that it was actually a repudiation of Black nurses as nurses, but also as American citizens. It was very much both. Those were both lies, of course, but it really was saying to Black nurses, you're not a real nurse, you're not a real American, you can't serve your country. So she just went to battle over this. I mean, she was in every meeting. She was not wanted in every meeting, but she was there. She would stand up and she would say things like, I fail to understand how we're fighting for democracy abroad when we don't have it here. And so she was really making those connections and pushing very hard. In the beginning of World War II, there was, again, a racist quota. I say racist quota because it's racist, but it's a racial quota, right? So it's like something like 56 Black nurses initially out of approximately 10,000 qualified Black nurses in this country were allowed, quote unquote, to serve, were allowed to sign up for the ANC. And this quickly became a real political situation because at that time, there was a nursing shortage. So I always want to say, like, when you tell me there's a nursing shortage, like, you got to go a little deeper. Like, what do you mean? Because there were entire field hospitals in Europe that didn't have a single nurse. There were hospitals that had, field hospitals that had like 9 nurses serving 3,000 injured service members. And so this was not just racist, but it was also like harming our service members who were fighting the
Right.
Nazis, right? So she pushed this and pushed this and pushed this. And finally, in 1944, they decided that they would end the racist quotas in the ANC and in the Navy. The Navy until then actually didn't accept any Black nurses. And I find her so inspiring, I think, because she really knew how to leverage public opinion, and she knew she was not afraid to fight. And she also really understood this kind of moral banner that she was flying under, that she was leveraging patriotism and leveraging the idea that these nurses want to serve their country. It was an argument that was very hard to argue against. I mean, especially as parents around the country were hearing that if, like, Johnny was injured, there might be no one to stop the bleeding and he would die
Right.
needlessly, right? So I think she's incredible. She really changed the world. But there are actually so many. I mean, I was just thinking, I just started watching The Pit.
Yay!
Way behind. But
Season 2's coming out, so like
I know. So I thought maybe I'd catch up. But I was just thinking about Jonathan Bartles, who actually, I don't think he is even in the book, but I did all these interviews that some of them didn't make it in. Jonathan Bartles came up with the pause, the idea that when someone dies in the ER, that there needs to be a minute where you honor the fact that you did your best, you tried to save that person, and honoring their life and your efforts. I just noticed that they did that in The Pit. And it made me think of him. But I thought, there are just so many things like that all throughout healthcare. There's a woman named, oh gosh, Marie. I'm gonna forget her name, but she came up with the idea of primary nursing, or the modern idea of primary nursing.
modern
The
idea.
idea
Okay.
that you would organize a floor around all of the nursing is done primarily by one nurse, so it's not split up among nursing professionals, but
It's
that
not like teams. Yeah.
every patient has that relationship. And the way that she came up with that was because she was hospitalized as a 5-year-old and she had a relationship with a nurse that really made her feel safe. And
Right.
so I'm just always thinking about, how do nurses know what they know? And then what do they do with that knowledge? And there are so many examples of nurses changing the world in big and small ways, just like that.
Yeah, I mean, I remember just kind of reading through your book and thinking about all of these different nurses and just being like, why didn't we learn this? And I think it's just obviously it's reflective of the practice that we have today because obviously like we know that obviously it all didn't come from Florence Nightingale. So where did all these various different pieces come from? And I think it's unfortunate that our education doesn't reflect the reality of what the true story is. And I really hope that we start seeing some shift and changes. And I think that again, having conversations like this, maybe someone out there will be like, hey, we should change our curricula to reflect an accurate history of how things actually happen and how things transpired. And I think that maybe this will inspire other nurses to have more conversations. Cause again, it's just even when I talk to other nurses, it's just like, oh, there are this nurse did that. Oh yeah, I didn't even know that. And it's just like we have the profession, like we should know this stuff, right? And I think even just speaking about the profession, and you probably might know where I'm going. This whole idea behind professional designation and the whole aspect of whether nursing is a profession. And I personally think that language matters, you know? And I know you're chuckling. You know where this is going,
Yeah.
right? And I think that, you've described nursing as a thread running through human history. How does reframing nursing as a foundational human necessity rather than just a job change the conversations around nurses' right to, demand better conditions, to be seen as a profession?
Yeah. Well, first of all, I think many things are true about nursing. And this was one thing that I found particularly challenging was to sort of be able to define it. I think actually it resists definition. And actually, I think that's part of its power. I have sort of given up thinking that someone could define it. There are many ways to define it, and maybe they're all right. But one way that I think about it is that it's the skilled and expert expression of a fundamental human instinct, which is to care for each other in times of need. So it's important that it's skilled and expert. And skilled and expert, of course, changes depending on where you are, what time you are. I mean, in history, right? You can find nursing going all the way back. And I think that it's really important. Well, first of all, professionalism and the word professionalism has really been weaponized to make nurses be silent. We say things like, "Oh, well, nurses don't unionize," or "Nurses don't speak up." Those
Right.
are not true. Nurses do unionize. Nurses do speak up. In fact, I would argue that is a fundamental part of nursing.
I agree.
And nursing is, however, so it's like I try to separate a little bit out the way that the word professional or professionalism has been used to keep nursing in a Victorian corset.
Right.
Nursing is a profession. Nursing is an incredibly skilled and expert profession, and you can do all kinds of things and specialize in all kinds of things and serve all different kinds of communities. So of course it's a profession. But I think it's important to also remember that it is the skilled and expert expression of a fundamental human instinct. Because in that way, I think it becomes clear that actually, nursing is kind of a project that belongs to all of us. I think that that's where you see sometimes, there's a lot of emotions among the public about nurses. Oftentimes, it's a sense of gratitude that kind of doesn't know where to go. It's because we don't know enough. It's because we don't understand nursing. But nursing evokes a lot of emotion in people. And I think that the reason for that is because actually we all know that this is fundamental. We all know that this is a fundamental role in society. There are certain roles in a functioning, caring society that you can't do without. And so again, you would never say someone invented it. Like who invented teaching? You know what
Right.
I mean? Who invented being a teacher? Who invented the idea of a community council making decisions for a group? Like government. Who invented, people didn't there you would never point to an inventor of those professions. They're something that we have always had because they're key to a functioning society, and nursing is one of those professions.
Yeah,
Yeah.
Sorry, continue. Go.
No, but so that's why I always find it. I think when you say, for instance, Florence Nightingale founded nursing, it makes nursing really small. It's like, oh,
It
nursing
does.
is just this little thing. It came from Victorian England. This one lady figured it out. Well, no, like, no, no. Not only is it wrong because we may not be fans of her, but it's wrong because no one invented nursing. How could that possibly be?
You're 100% right. And I think that maybe that's where people trip themselves up in relation to understanding the profession, where they feel that it's one source, right? Like I said, there's this kind of tunnel vision where it's just like, all right, this is how it should be, and it's so much more than the sum of its parts. It's so much more than even what we even think. And I think that's why some people say, well, nursing is an art, it's a science, it's both of these things kind of interwoven together. And I never really thought about a single one definition of nursing. And I think if someone had asked me to define nursing, I think I'd probably still have a little bit of difficulty in terms of saying, okay, well, it's this, because it really isn't one thing. But I do think that the one thing that connects nurses to everybody is that sense of wanting to make people better, heal people, or have them leave better than once they kind of came in. And I feel that the nursing is fundamentally about seeing a better form of humanity than we already have. So I feel like it's so much bigger than, these various different limited definitions that we try to put on things. And I think people want definitions because it's easy. Obviously, it's the easiest thing to do, to be like, okay, here's the label and that's how things are. But things aren't always like that. And I think that, that's where again we can have these kind of conversations and arguments with people who want to put things in a box and make it neat so we can be in a certain place. And that's where I think again, where some of our nursing leaders need to think outside of that box and not to be so rigid in the way that they think about nursing, because it isn't one dimensional. I think it's multidimensional. And I think that the more that nurses can see how transformative we can be with the way we deliver care, the way that we innovate, the way that we think about things, is we could really like make some pretty fantastic changes to our healthcare system. But I still feel that there is that struggle. That's probably the hardest piece, where nurses ourselves are the ones that are trying to limit and define what it is, when I think it's so much greater than that, right?
Yeah. Yeah. And it
And
belongs to each of you. That's the other.
yes,
Sometimes I speak to nursing students, and not that I necessarily have anything of value to impart, but
it's not true.
they're building their own knowledge base. But one of the things I always want to say to them is like, your practice is yours. It belongs to you. Like it's something that you carry with you. It doesn't belong to a hospital. Like it's not theirs. It doesn't belong to
I like
anybody
that.
but you. And so it's not your employment. It's your knowledge. It's like what you know.
Yeah, no, I think that's such a beautiful framing of being like, this is something that belongs to you. Because I think, again, when we are, for example, we're seeing right now that nurses are going on strike and people don't understand. And a lot of this kind of commotion about, okay, people or profits. And I feel like that is so important for a nurse fundamentally to understand that it belongs to them. Because I feel that, again, when I speak to a lot of nurses, a lot of the conflict isn't surrounding patients, but it's surrounding this healthcare system where they feel like they're just this cog in the wheel, and that they have no agency, no power, no nothing whatsoever. Where it's just like, if it is something that belongs to you, it's something that no one can ever take away, right? You wouldn't sit there and say, okay, this thing that's within me, whether it's, self-love or respect or whatever, that belongs to someone else. We would say that that's something that's inherent to who we are fundamentally as an individual. And again, I'm not saying that, nursing, how would I say this? I would not say that nursing is a calling. That's a whole other
Right.
fight for me.
These conversations always have a caveat, right?
Right. So I'm not saying that, but
Right.
however, I am saying that the practice and the discipline and the understanding of the power that you have as a nurse is your own. And no place that you work for, or no employer, no manager, no other person can take that away from you. And I think that is something that it took me a very long time to learn. And I don't want to say that I learned it the hard way, because again, when we talk about bullying and incivility and harassment and violence in nursing, you should never have to learn
No.
that you are valued by being unvalued. You know what I mean? And I think that again, it's like, it's a misnomer where nursing sometimes teaches you to not value yourself. And that's work
Yeah.
that we have to do. But I
Yeah.
think it's such a powerful thing that you said, and I think nursing students need to hear it, that it's like this is something that you own and something that no one else can take away from you, because that knowledge is yours, the ability to practice is yours, and the fundamental point that you can step away whenever you want to, understand if you're being disrespected, to walk away, to use knowledge and power or influence in a different way, that's yours too. And I wish someone had told me that. Like, I wish I had a mentor that was just like, you can fuck it up too.
Yeah.
You know what I mean? Like,
Totally.
you have the soft side, but you have also a very powerful side as well. And I wish, oh my gosh, I love that, Sarah, that you can give that to nursing students. And I hope that when they listen, they're just like, they have that aha moment where they're just like, yeah,
I
this
hope
is
so.
something.
Yeah, because I do think that there's a lot of energy invested in having nurses not understand that. It's
I
like,
agree.
if your
Yes,
manager says or your CNO says, then that's what you're doing. But actually, I mean, you know, it you can walk away and you are still a nurse. If you want to
right,
be, you are still a nurse. You still have the knowledge, you still have your practice. And the other thing I always think about that is like there are so many ways to be a nurse, and not just in the sense that like, well, you can work in community health or you can work in hospice or you can do, of course, you can do so many different specialties. But there's also the idea of like, there are a lot of nurses that I love to talk about who took what they knew as nurses and have used it in a different field. Honestly don't even know that I would call it a different field. It's like a different landscape. So, for instance, I don't
right.
know if you know Tariq Khan. He is a nurse from Philadelphia, and he did a lot of work trying to get vaccines to elderly homebound folks during the really, the sort of acute part of the pandemic. And what he saw when trying to do that inspired him to run for office. And so, now and there's also actually Farah Souffrant Forrest, very similar thing. She's a nurse from Brooklyn, and now she's in the New York State Legislature in the Assembly. So these are examples of two nurses who took what they knew as nurses and decided to become politicians and policymakers using what they know. And they're practicing, right? That's their practice now.
And I think
It's
that's
neat.
how nurses take up space, right? I don't think, again, nursing has to be in one particular place. I think sometimes we get so stuck in our head that nursing has to be at the bedside. Like that's what makes a good nurse. And it's like, no, like what makes a good nurse, again, is inherent in you and your practice, and that can go wherever you are. And I think that we're seeing lots of non-traditional, like I would consider myself to be in a non-traditional nursing role. I'm an advocate. I do a lot of conversations with other leaders and experts, and urge folks to understand about health literacy, and then also hold like politicians accountable for the healthcare delivery or not that they are saying that they're going to do. And I would have never, if you asked me 6 years ago, would I have been in this space? I'd be like, what is that? Like, that's not a job, but
Yep.
absolutely it is, right?
Yes.
And I think that's so important that we do take up space in this way. And it's kind of this whole idea with this, nurses who don't play nice. Like, we have to be able to be in these various different places, because at the end of the day, again, like you said at the top of the episode, one of the biggest parts of our job is advocacy. It's like literally just to say, hey, something's not right here with the patient, or something's not right here with the system, something's not right with the community. Flag it so we can create policies that create change. That's fundamentally what we should be doing. But again, there's a little bit of inherent fear with being vocal.
Yeah. I mean, I think that the idea that what nurses do is assess, make a plan, carry out the plan, and then evaluate the plan, that is a very fabulous way of organizing almost anything, right? Like a policy. You want to, have a health department policy. Okay, well, what's the problem it's trying to solve? Okay, how will this work? Well, we think it'll work like this. Okay, we implement it, but then we evaluate it. Did it work to solve the problem or not? Do we keep going, or do we circle back around and make a new plan?
Yep.
And
It's
that's
literally,
nurse.
sorry, go ahead. Sorry.
Yeah, it's nursing, right?
Yep.
Like with respect, like you're nursing, like nurses in politics are nursing. Like they are using, I think that nurses know things that nobody else knows, because I think that they are intimate with people in a way that nobody else is. It's like being intimate with with people and the body together gives a kind of insight that other professions just don't have. I mean, it is unique. And so being able to take that and take up space and make noise and take that knowledge to wherever you want to take it, to me, that's the power of nursing.
I completely agree, and I couldn't have said it any better. Um, I'm going to take a little bit of a turn here.
Or
I think the other piece is, so as you said, we do hold a lot of power and we do hold a lot of weight in the way that we can practice. And I think, of course, there's things that are positive and of course there are things that are negative. And those are the things that people don't want to talk about. But of course, we can't avoid those conversations and we have to have them. And I kind of want to go back to the book that you earlier wrote about. So that I think it's called Early, An Intimate History of Premature Birth. And really within the recent news of, hearing the death of Dr. Janelle Green Smith, the nurse who was cruel and ignored, I believe her name is Kiara Jones, the nurse that was at the Dallas Regional Medical Center. And then lastly, Mercedes Wells. And now there's this whole conversation around the Wells Act. I think my question surrounding this is really around the work that you've done about dismantling structural inequities, and that I think that nursing does have a role to play at dismantling these inequities and, understanding that there is a Black morbidity and a maternal crisis as well as neonates. I think the other piece is knowing that, not just Black mothers, but our babies also are suffering at some of the hands of, some of the most devastating effects. And sometimes it's related to nursing. And that's a hard pill to swallow because, again, the whole idea behind of nursing is that we're trying to help, we're being supportive, we're understanding the person's perspective, but we have a role to play when there is inequities. What would your take be?
well, I agree with you. I think that nurses could do so much to alleviate the problem of Black maternal mortality or infant mortality or morbidity. And a lot of times they don't. Sometimes they do and sometimes they don't. And the reality is, I think hold nurses to a high standard, not because of some idea that they're saviors, but because in fact, like your hands are on the patient. Like you are the ones speaking to the patient. Like you are the closest ones. And it is really hard. And I know that from talking to so many nurses, but inherent in that is that nurses as a whole, and white nurses in particular, could do so much. And it would involve stepping out, right? Like stepping forward, like pointing out that the way things have always been done is not always the best way, not just going along. And, you know, I mean, that's my take on that white nurses need to do better and could do better, certainly could do better.
Yeah, I think, sorry, go ahead.
Uh, And, I've been writing about and sort of tracking Black maternal mortality for like as a professional for a decade now, and it has only gotten worse and or stayed the same. I mean, we have not made a dent, and it's like criminal. I don't know, it's hard to think anymore of like what can break through. We cannot stop trying. We have to. But, throwing statistics in people's faces doesn't seem to be changing anyone's behavior. And so, yeah, this week in particular, I'm like really upset about it and I'm just thinking about what would it take? Like what would it take to change this? But
Yeah.
also it's a huge question. And I'll speak specifically to the American context. I'm sure it's quite related in other countries, but we know from all kinds of literature, from scholars like Dr. Monica McLemore, that exposure to racism is a social determinant of health. Like it's a toxin, like it harms people's bodies and minds. And it's not like, it's not some nebulous thing. It is real. It's measurable. We have measured it. We have people, scholars smarter than me. There is decades of literature on this, that exposure to racism harms your health. And so that is certainly one aspect of that is medical racism, as you know, but it's not just medical racism. It's everywhere. It's the cumulative effect on the body. And so we need everything to change, and we need to keep trying for everything to change. But I think that specific to the medical settings, nurses have a tremendous amount of power to change this. The other
I
thing,
agree.
yeah, the other thing that, and this is not a perfect, there's no perfect. I have no perfect solution to suggest. But one thing I wrote about a while ago was centering pregnancy and other group pregnancy models. And they did seem, and I haven't looked into their literature for maybe like 6 years now, but when I was researching and reporting on that, um, what had been found was that a lot of the disparities in terms of premature birth, infant mortality, preeclampsia, things like that, that the disparity went away when people got group prenatal care. So what's powerful about group prenatal care? Well, one thing, and this is something that Dr. McLemore pointed out to me, is that providers are essentially surveilled by other patients, right? So providers in a room with 10 of probably mixed races may not behave the same way as if they're one-on-one with a Black patient, right? There's that. But there's also this sense of feeling safe because you're there with other patients, other women who maybe are from your neighborhood, who are familiar to you. And it sort of cuts the power dynamic a little bit. You still get the same checks, you still get the same information as you normally would, but you do it in a circle of other women who are due around the same time as you are. Another thing that's powerful about that is that not only are you getting information from the provider, and it's usually a midwife, but you are also getting information from your fellow patients. So it's like, oh, my lower back hurts. Well, the midwife may have one thing to offer, but maybe, the other patients have something else to offer. And so you're getting a lot of good information from multiple sources. Maybe you're feeling more safe. The provider is on their best behavior, and there's room for you to show up as a human. And I think that was the brightest spot that I found. And I will say, this is so dark. I asked a researcher who studied centering pregnancy when I was writing about it. I was like, I don't understand. Why is this not available to everyone? I mean, I do realize that it involves setting up your practice differently. It involves sort of like a revamping of the financial model. And she said, well, insurance companies like it because people are less likely to give birth prematurely. But hospital systems don't necessarily like it because, first of all, they have to take on the organizational and sort of upfront investment in changing the practice. But
Right.
also, the NICU is a huge driver of profit. Huge. So, hospitals have absolutely no incentive to change their OB practice models and prevent a lot of premature births, which pay them gajillions of dollars. And so, do I know that that is true in all cases? No, I was told that by a researcher who had good reason to know. I also don't think it even necessarily requires us to think about like a hospital administrator sitting at their desk being like, yes, more premature babies. I think
Right.
it has a lot to do with inertia and with the profit motive. And those things can go very unsaid, and I think almost not even fully conscious on the part of some people. Do you know what I mean?
Yeah, no, I think what you're saying and what I'm kind of gathering is if again, if there's no profit margin to it, if it's not going to benefit the organization, then it's just more money to be spent versus more money to be had. So it's it's not that they're intentionally doing it,
Right.
but it's intentionally
Necessarily.
being done.
Yeah.
You know what I mean? Like
Yes.
it
I
still is
can't
occurring.
right. I can't speak to people's motivations, but I can say
Right.
what's happening.
Yeah. Yeah, no, I think that's troubling, and I feel like that again where yes, here's Canada, the US. I don't think that there's a border in terms of how those things are delivered. I feel like the same things that happen there happen here too. I feel like one of the biggest concerns that we have is in Canada, particularly, is we don't do a good job of collecting data whatsoever. So a lot of the data that we have is we are extrapolating from the States and saying that likewise it would be similar. And then as well as many anecdotes from people like myself and other people who have had, issues related to their deliveries and their birth. Like I am a Black mother who's had preeclampsia twice, eclampsia once, and 3 out of my 4 babies were in the NICU. So it's like I'm like a perfect checking the boxes, right? But I think again, I was a labor and delivery nurse and I still wasn't listened to. So this is where I want to bring it back to being like, I do believe that community solutions are hugely going to be a part of it. So there has to be we are in the model of individualism, right? Everybody wants to do things on their own, and that's not how societies typically were run. Here's my anthropology mind coming on. Whereas a collective, we used to do things together. Communities used to do things. Birth was a very community led event. And I feel like that primary model is definitely one that can also work. But I feel the other piece is nurses are so close to it. Like, I mean, as a labor and delivery nurse, you are literally like, we are the ones that, for the first when they are in active labor, we are in charting every 15 to 5 minutes. Like we are there and we see it. So if we notice that trickle of blood seems a little weird, that seems a little bit more runny, the uterus is a little bit more like we are right there. So I feel like some of those interventions have to come from nursing. It has to come from policy design. It has to come from doing things over and above. That's the whole piece about equity versus equality. We can't do the same for everybody because it doesn't work. The outcomes aren't the same. So we have to maybe take extra measures and do extra things in place for these various different populations. And I believe that will be a part of the work of nursing. Like I see that nursing has a huge role to play in this crisis. But if we can't save racism, you know what I mean? You know where I'm going? Like even when I worked in quality improvement, when it came down to like, okay, we're sitting in a room with everybody, there was a death, there was harm, whatever the case may be. And you are sitting with providers and managers and you say, was racism a factor? I'm colorblind. I don't see color. I don't see race. No, it couldn't be because she was Indigenous. No, not because that person had a mental health. No, not because they're Black. And it's like, if we can't ask the question, guys, then what are we really doing? And that's where it's like the rubber meets the road. And we're going to have some very, very hard conversations because we can't keep going this way. Like we can't keep going this way. And again, death has no age range, no basis for wealth. We've heard, from Serena Williams to anybody, like it doesn't matter. And it can't be this way. And I feel like nursing has a big role to play in making some of these changes.
Yeah. I mean,
But
nursing could be the hero in this moment. I mean, if you want
right?
to think about it that way, right?
I agree.
Just imagine what would happen if there was a real concerted effort to implement equity in nursing care.
Yeah, I think you might be onto something. No, like
You're
I
right.
think
As long as people can't even talk
we
about
can
the
save the day
problem,
there.
you could save the day.
I agree.
Not entirely. Like I said, there's a whole, but it would be huge, huge. But as long as the problem can't even be acknowledged, that's yeah. It
Yeah,
needs to happen. It just needs
yeah,
to happen.
we gotta be able to bring back the words diversity, equity, inclusion in some of those places in the world. You know what I'm saying?
I do. I do know what you're saying.
But
Agree.
we right?
Yeah.
We've talked about a lot of different things, right from, the great work that you're doing to some of the hard truths that we must have as nurses and healthcare providers. And even, as people who are a part of I would say you're still a part of the healthcare world. If you are working in journalism and you're writing about healthcare, I would still say that you're still very well in tune and a part of this world. But with all the conversations that we've been having related to nursing and change that we want to see, is there anything that we might have not touched on that we might have missed that you feel like it's a burning thing that we should address before we go. I see the time, so I'm not going to keep you too long.
Don't worry, a total pleasure to talk to you. No, I think that I really do wish that nurses knew that nursing has looked, speaking of diversity, nursing has had this incredible diversity of practice throughout history and to today. And that means that, sort of connecting it to your practice belongs to you, that means that you can do anything with your practice and that you'll be doing it in like a long, long line of other nurses behind you from all over the world, from all different times and places. And I always want to emphasize that because I think it opens the world up a little bit.
No, I think that's beautiful. Is there what are you up to next? Are you writing about Black maternal morbidity? Please help us.
Oh my God. I would love to. I mean, and that is I always think about, am I the right person to write a story?
Fair.
When I was writing the book about prematurity, I felt I was the right person to write that book in the sense that I was a preemie. I gave birth to a premature baby and I wanted to really delve into that. And as I researched, it became immensely clear that racism was a huge part of that story. And so I was just grateful to even have the chance to bring some light to that. Um, but, so whenever I find myself in a position where I think I'm the right person to write something about that, I always jump for it because I think it is one of the biggest problems in healthcare today. Um, and I want to be part of bringing it to light and also proposing different ways. How can this be different? So there is that. I have recently been writing a lot of different things.
Yes.
It's funny, the Make America Healthy Again movement has provided me with many opportunities for stories. I recently wrote for The Guardian about hyperbaric oxygen therapy when it's used for wellness, not under the guidance of a nurse practitioner or a physician, but instead under the guidance of somebody who is not trained to use that equipment. There have been a
Right.
lot of pretty horrific accidents because people are being told that it will cure autism or it will stop you from aging, and none of that is true. So I was happy to be able to debunk some of that. I also wrote about private equity in healthcare
Yes,
recently
I
for the New
noticed. Yep.
Republic. And another big problem in healthcare, what happens inside a hospital when private equity is squeezing the profit out of it.
Yep.
One
And when
thing
they
that
dump the hospital afterwards.
From the hospital afterwards. One thing that I did, I didn't enjoy writing that story exactly, but one thing I was grateful for were the clinicians who were willing to speak with me on the record. This is sort of an ongoing issue, which is that nurses are quoted as experts only something like 2% of the time in news stories. I always invested in quoting nurses as experts. But it can be hard to get nurses to speak on the record because, a lot of times they've had the fear of God put in them about don't talk to anyone, don't raise your voice, right? And so I think that's something that I'm always grateful when people are willing to talk to me. There's a wonderful nurse named Alfredo Sanchez who talked to me for that story. He had had a horrific experience. In a hospital that had been, really stripped of all of his assets, and
Wow.
he worked in the trauma ICU, and he was willing to talk to me about what that looked like.
Jeez.
And so I was very grateful to him, and I always like to highlight nurses as experts, and whenever they will speak with me, I am pleased to speak with them. And then I also, sort of courtesy of MAHA a little bit, Make America Healthy Again, I recently wrote a story for Vanity Fair about the ways that longevity influencers are obsessed with their penises and the ways that they sell people like devices to make their penises more healthy, even though, again, there's no evidence for that. But also sort of tracing that back in history to find that this has been a long running obsession of people who want to live forever. So, for instance, around the turn of the 20th century, men would have bits of chimpanzee testicle implanted into their own scrotums as a way of stopping themselves from aging. That that did not work.
But I mean, again, this could be a whole other conversation. Men's wellness, right? Like us women were just, over here crying about, endometriosis and
They're literally injecting their dicks with Botox, and that seems like
well,
a bad idea.
could be a really good surprise.
No wrinkle, none at all.
Oh
I
my
don't.
goodness. But yeah, no, I hope that you continue to have these conversations, that you continue to bring nurses to the forefront as experts. And please continue talking about wellness, because like there was just another recent story, I'm sure you probably saw it, where a very influential person is now pushing a wellness product where I'm like, just have some Greek yogurt.
Yep,
Like, I mean,
yep,
it just
yep.
makes me really
Have
frustrated.
some almonds. I don't know. It's so bizarre.
It's, I think to myself, I'm like, I think this is tied to the fact that GLP-1s are being talked about a little bit more. And of course, a part of the diet, if you're on a GLP-1, is to increase your protein. So why not have, anyways, we'll leave that for another time. Thank you so much, Sarah, for coming on the Gritty Nurse podcast to share your wisdom and knowledge with me. We'll have to have more conversations, and I'll wait to see what your next book might be. No pressure. And I'll be continuing to read your articles. And thank you so much for continuing to raise nurses' voices and bring that awareness and advocating for on our behalfs to show people how much wisdom that we truly do have.
Amie, thank you so much. And likewise, I can't wait to see what you do next. I am thrilled to be in conversation with you. So thank you so much for having me.
Yes, absolutely. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.